Myeloid leukemia is a blood cancer which affects 1 in 7,000 young people in the UK. But among children with Down syndrome, around 1 in 50 will develop the disease.
But now a new test has been developed which could help to catch it at an early stage by identifying those most at risk. Let's discuss this now with Dr. Stefan Meyer, who's a paediatric cancer specialist, and Hollie, who was treated for acute myeloid leukemia, aged 16 months. She's here with her mum, Hayley.
Hello.
Hello, thank you very much for coming on. Now let's start first with you guys, Hayley and Hollie. 16 months. When did you start to think there might be something wrong?
Hollie had a PGI rash from 3 months old. We took her back to the doctors many times and they were saying it could be due to straining because she was constipated. She then started to bruise really easily and bleed from her gums. Again, kept taking her back and forth. They didn't pick anything up. That was from 3 months old. Finally then, 16 months, they'd done a blood test and they showed her platelet count was only at a 9 when it should be a bit higher than that. So we had to stay in overnight just in case for her.
Did you feel you were getting the sort of support you needed?
No, I think they were pushing everything, all the symptoms on having Down syndrome. They didn't once say it could be this, anything. They just said it's just straining from having Down syndrome, being constipated.
But you thought there might be something wrong. You suspected it might be leukemia?
Yeah, I had a feeling. I didn't want to say because I thought I might jinx it. And I thought if I say anything out and it comes back, then it'll be my fault kind of thing. But no, deep down I knew it was leukemia.
And Stefan, what we now have is a test. So is the test looking for, if I read this right, it's looking for a marker in the blood?
I think we know for a while that children with Down syndrome can get leukemia, and I think it's just finding the changes that are associated with leukemia, looking on a kind of standardized way, not to overlook.
All right. So you knew the marker was there, but what was being missed? Do you think, or what is missing by paediatric cancers?
There was a bit insecurity and inconsistency about how people approach the problem. And with having this test now and being able, after studying all these cases in Oxford, they now come up with this is what we're going to do, not to overlook for a long time these cases anymore.
But it was almost a year between those first symptoms in Hollie and getting any kind of diagnosis. I mean, what kind of difference could it have made in Hollie's case?
I think in general, the earlier you get, the easier it is to handle any complications from it. We can't prevent it, but we can make the treatment a lot easier and try to avoid any complications that could be dangerous.
Because Hollie was how old when she got it?
She was 16 months old,
Okay.
and she had to have 4 rounds of chemotherapy.
Right.
Made her very poorly. She was in isolation at one point where she's so active and trying to keep it in the room. I think it's about between 7 and 10 days.
Who's this?
Is that her? Chemo duck.
That's chemo. That was chemo duck throughout as well, and he's got a little plastic thing here as well.
Wiggly
Did
thing.
you have one of those as well?
You had too, didn't you?
Yeah. Did it? Stefan, you were saying that if you catch it earlier, it is easier to treat, is it?
It's easier to manage. I think the complications that can happen with high white cell count, with the liver getting affected, that can be detected earlier and managed better.
So what are the symptoms, and are they any different for children and babies, small children, as for adults? I mean, what should parents be looking out for?
It's just presenting initially very non-specific.
Right.
Tiredness from not enough blood being produced, very little red spots, the petechial spots from not enough platelets being produced, and infections from not enough white cells being produced. And there's not a specific way that this can present, but I think that there is now with the test a much better way of kind of working this up, not to miss it.
Yeah. So Hayley, for those parents who have Down syndrome children, what would be your advice after the experience you went through?
always get a second opinion. Don't take a doctor's words. I think you know your child best. So
Because
if think-
you suspected quite early that you had leukemia.
One of our good friends, her little boy had the leukemia, and he came in my mind, and she phoned me up. She was always on the phone to me. She lived like miles away from us, but was always phoning, and so she was a rock for us. It was because I know her son was diagnosed and remembered his symptoms, and I thought, hang on.
So is Hollie in the clear now?
Yeah, it will be 9 years on Friday she was diagnosed, and yet she's had the all clear now.
Great.
You're really well, aren't you?
Good. Very sweet. Well, thank you both for coming on and sharing that with us. Trust your instincts. That's the advice.
Yes, and always have another look.
All right. Well, thank you all for coming in.
Thank you.
Thank you to Chemo Duck too.
Thank you, my duck.
It's 24 minutes past 8.